Hey everybody, it's William Warfield here with you, and we're starting this new segment here on, every week, basically, with Med Center Health, Dr. Malempati, and sports medicine with Malempati, I think is what we're going to call it there, right, Doc?
Yeah, I think certainly really been enjoying this and this partnership, and yeah, would love to talk more about sports medicine whenever we can, especially in different times of the year when specific sports are playing, and deal with and talk on some common injuries.
I know, that first video that we did, thousands of views already on that. So how are we going to top that today?
Well, we're going to certainly try. Hopefully we get this out to a lot of baseball and softball players, especially that season's coming around. So maybe
Yeah.
this topic will become really popular and take off.
I'm looking forward to this one. I've got a lot of baseball players in my household. My youngest one and my middle child, both, very active in baseball. And so we're talking today elbow injuries and throwing athletes, and specifically UCL repair and reconstruction, also known as Tommy John surgery.
Yeah, so a very hot topic in baseball when you talk about youth leagues and up into middle school, high school, college, and certainly the pros. The elbow in general takes a lot of load and a lot of valgus stress on that joint in a normal throwing motion. What's important is to focus on mechanics,
Right.
make sure the core is strong because the throwing motion actually is a lower body motion, and most of the energy and speed comes from the lower body. So making sure that area is strong, making sure the core is strong, and then focusing on mechanics is really important at a young age. That will decrease that stress and load on that elbow. After that, you talk about pitch counts and you talk about taking certain time off throughout the year. Certainly a lot of the experts recommend 2 to 3 months off of throwing throughout the year. So, the elbow and the shoulder really aren't made to be throwing 12 months out of the year. So it really needs that time off to decrease any overuse injuries.
Baseball and softball has become a year-round sport. You got go from basically the rec league to you're in your high school season or your middle school season, and then all of a sudden they're starting to do like winter leagues and things like that. So it really has become this whole year-round thing. What are some of the most common injuries that we see in the elbow due to overthrowing?
Yeah, so there can be a lot of strains in the musculature. There's a lot of muscles that attach on both sides of the elbow. And through overuse and continued throwing, those muscles can be strained, partially torn, injured. The one that's very severe that we want to try to avoid is the injury to the ulnar collateral ligament. There's three bands to the ulnar collateral ligament. There's an anterior band, a posterior. They're actually bundles, but there's an anterior bundle, posterior bundle, and a transverse bundle. But specifically, the one we're really focusing on is the anterior bundle because that's the one that really gives velocity and adds to stability of the elbow. So when that becomes injured, that has a potential to become a major thing because sometimes when it's partially torn or completely torn, that will require surgery to fix, and that's a long recovery. If you look at the major leagues, that's over 12 months. The latest literature that has come out has really shown pitchers that have undergone Tommy John surgery, a very low percentage has come back to that pre-injury level of throwing or pitching.
Yeah. Yeah, so what exactly is Tommy John surgery, Doc, and when needed, what injury has occurred?
So Tommy John surgery refers to a reconstruction, mainly of the anterior bundle of the ulnar collateral ligament. So when that's torn, if there's a high grade tear greater than 50% or completely torn, has failed non-operative modalities and continues to have pain, sometimes numbness and tingling in the fourth and fifth fingers associated with the ulnar nerve, but instability and pain in that elbow with an MRI diagnosing that injury, you can reconstruct that ligament. The most commonly used tendons to reconstruct that ligament are actually the palmaris longus graft. We typically try to use someone's own tissue to reconstruct that, but the palmaris longus autograft can be used. Hamstring is somewhat used, and there's some other less known or less used grafts as well. And that's different from UCL repair. So if the ligament is partially torn, or not nearly completely torn, and in younger patients where the growth plates are still open, you can consider doing a repair on the UCL, which is somewhat not as big a deal as the reconstruction, and certainly a shorter recovery period.
Yeah, I know some, being a Major League Baseball fan, I know that when, a pitcher has to have Tommy John surgery, they're usually out for a while. What on average is the recovery and rehab time that you would have with such surgery?
So typically, it's a long recovery because, first of all, you've got to let that repair, that reconstruction heal. We've got to get the swelling down after surgery. And then after that, it's a phase of working through range of motion and getting full extension and flexion of the elbow. Once that is achieved, then you can begin the strengthening phase. And then eventually, there's a throwing program where you kind of step back into throwing slowly. Typically, for reconstruction, you could look at anywhere from 9 to 12 months. I know in the majors, it's commonly even more than that. In a repair, it could be several months less than that. But typically, you're looking at somewhere around 9 to 12 months.
Dr. Shaitu Malempati, you're always, it's always good talking to you and getting this information out there, especially now that baseball and softball is starting to do their preseason training. And, it's just valuable information to those athletes, being able to hear that from you guys down at Med Center Health and UK Healthcare Sports Medicine. So we appreciate your time today.
Thanks, William. If there's one piece of advice I could give out to kids, coaches, parents, is to pay attention to those pitch counts, and they're all posted online. The AOSSM Sports Medicine Academy of Orthopedics has a website you can go to. Their pitch counts are all there, so everybody knows them. You can't be pitching every day. Need to take some time off, and definitely a couple months off throughout the year to let the muscles and the bones heal and avoid any overuse injuries.
Dr. Shaitu Malempati, I look forward to doing this, every week or every other week with you, talking about sports medicine and all the things that are going on there in the sports medicine world. Thanks again, Doc.
Hey, thanks a lot, William. Great topic, and really appreciate you having me on.
Shaitu Malempati with Med Center Health. He's also affiliate there with UK Sports Medicine, and we appreciate all that they do for us here on the network.